Thank you for coming to our May office hour. This year, our series is Innovative Practices to Sustain the Family Peer Workforce. And today, we're going to hear from Carla Preto from the Association of Children's Mental Health in Michigan and Ricky Harris from Tennessee Voices. They're going to talk to us about sustainable funding for family-run organizations at the state and national level. I'm Dana LeBranch, and I'll be facilitating today. First, we want to thank SAMHSA for funding this and all of our activities at the National Family Support Technical Assistance Center. We do want to acknowledge that the views expressed on today's webinar are those of the presenters and not necessarily of SAMHSA, but we do thank them for their funding. And we also want to thank our principal investigator, Dr. Linda Gargan, the Executive Director of the National Federation of Families. Before we begin, just a few quick housekeeping tips. Your microphones are muted now. We would like you to keep those on mute during the presentation portion. We have some really great, rich content for you today. We hope to have time for questions at the end of today's presentation. At that point, you can unmute yourself and ask your questions live. You can also put questions in the chat throughout today's presentation. If we run out of time for questions, the presenters will be following up to answer anything that you left in the chat for us. You can use the raise your hand feature if you'd like to be unmuted once we do Q&A. If you have any technical issues throughout today's webinar, you can send a message to one of the NFF staff members, myself, Gina, or Lachelle. And we are recording this session, and it will be on the NAFSTAC website and the NFF YouTube page within about 2 weeks of the presentation. Everyone will receive the slides and a link to the recording if you registered. You'll get those by email once the recording is available. We do not offer CEUs for these sessions. However, you can get a certificate of attendance, and you'll get that by taking our feedback survey, which should pop up right at the end of the Zoom, and we'll also put the link in the chat at the end of today's session. Once you finish that survey, a link to a certificate will pop up, and you can download that and enter your name in it. And if you have any questions at all about the certificate, the recording, the slides, anything about this webinar, you can email me after the session. We want to remind everyone that NAFSTAC uses family-driven language in every event that we do. So we ask that you do the same in the chat, in the breakout rooms, and during the Q&A session. Please make sure that your language is trauma responsive. We try to be strengths-based. We avoid blaming caregivers. We are community-driven, person first, respectful, non-judgmental, and we make sure that our language is consistent with our actions. I'd love to remind you about the goals for our office hours series. We have 2 more sessions after today, so we'll hope you join us for those as well. In the Innovative Practices to Sustain the Family Peer Workforce series, we are looking to support family peers to add some of the innovative practices that all of our wonderful presenters are sharing to their toolboxes to better support families. We also hope that any leaders or emerging leaders on the call are inspired to adopt some of those practices so that their organizations can be more sustainable and so that we can sustain the family peer workforce as a whole. We also hope that these sessions will introduce other people that work in behavioral health to all of the great innovative work that family peers are doing so that they can better integrate family peers onto their support teams. For today's office hours, we have some unique learning objectives. By the end of the session, we hope you'll be able to identify some key components of a diversified funding model. That includes public funding, private grants, and donor contributions, among other funding streams. We also hope you'll be able to gain some really practical strategies that you can implement right now for navigating grant writing, report requirements, and relationship building with funders. And we hope that you'll be able to explain the differences in requirements for maintaining federal, state, and foundation funding streams. We always love to start out with getting to know what your organizations do a little bit. So one of my colleagues is going to put a link into the chat to take you to our Mentimeter poll. You can also go to www.menti.com and type in that code 22404357. We have 3 questions for you. What is your role in your organization? What funding streams do you have access to? And have you ever applied to a grant? So let's take a look and see what folks are saying. What is your role? If you are answering other, we'd love to see in the chat what other roles we have in our organizations. Got 3 executive directors or leaders, 1 family peer supervisor. Got someone in the Amy from the chat. She's in development. That's great. Keep answering that question. I'm going to circle back to this one. I'm just going to hit next so that you all can answer all 3 questions. The second question is, what funding streams do you have access to? We've got lots of choices there. Federal grants, foundation grants, state and local contracts, Medicaid reimbursement. You can check more than one. Private insurance payments, corporate giving, donations, earn income, and other. I keep answering that question too, and I'm just going to hit next so you can answer all 3. The last question that we're interested in is, have you ever applied to a grant? Oh, you can only select one. I'm so sorry. Must have set that one up wrong. If you had more than one funding stream, you could put your most primary one in the Mentimeter, and you can share in the chat if you have multiple funding streams. All right, let's just review what we have in there, and feel free to keep answering that survey question on your own time, because we will share the results of this survey with the slides. It looks like we have the majority of folks that are answering the question here are executive directors or leaders. And then we have some other folks that have other roles in their organization, and 4 family peers and a 3 family peer supervisors. And then in terms of the funding stream, it looks like the most popular primary funding stream is state and local contracts, and then federal grants coming in second, donations coming in third, and then we've got a 3-way tie between Medicaid reimbursement, earned income, and other. And the majority of you, it looks like, have applied to a grant before, with a few folks not doing that yet. All righty. Thank you so much for telling us a little bit about where you are in securing funding for your organization. Now I would love to introduce our 2 phenomenal speakers, and then I'll turn it over to them. First, we have the Executive Director of the Association for Children's Mental Health out of Michigan, Carla Preto. In addition to being a mother of 3 and the ED of ACMH, which is Michigan's statewide family network, she also leads a team to provide peer-to-peer support, leadership opportunities, and advocacy for families and youth. She's going to tell you a lot about her partners, so I'll skip over that, but she is doing family-driven, youth-guided work to expand crisis supports and promote equitable access to services. Carla has a lot of passion about systems change, and I can't wait for you to hear about how she's funding that at ACMH. We're also going to hear from Ricky Harris, who's the Executive Officer for Tennessee Voices. She has a master's degree in marriage and family counseling and in Christian education. She has been with Tennessee Voices since 2011 and has done a masterful job of leading them, and that has led to her winning many awards in Tennessee and Texas for her roles as a leader, advocate, and a collaborator. We are really excited to have both of these great executive directors with us, and I'm going to pass it over to Carla now to start us off.
Thank you so much, Dana, and thank you all for being here this afternoon. I know Ricky and I have met with Dana previously, and we're both really excited to be able to share with you all some of the things that we've learned. And I know it's a mixed audience this afternoon. And I think with my experience, I've been in this role for 2 years as executive director, and Ricky has over a decade experience in her role. And I think you'll hear something that is applicable to everyone in the audience, some tips and tricks of things that I've learned being newer on the scene, and then some things that Ricky has learned from her extensive experience. So I hope that you will all be able to take away some useful information from today. The first thing I want to bring us to, sorry, I got to pull up the screen that's displaying, is the mission of the Association for Children's Mental Health, and I'll just abbreviate that ACMH going forward. And the reason that I put the mission is not for us to have one more time that we go over a mission, but really your mission has to be central at the heart of all of the funding that you are seeking, because we want to avoid mission drift. So whenever you're starting out with thinking about where you're going to seek funding, it needs to align with the mission that you have for your organization. And so for ACMH, we are focused on children and youth with serious emotional, behavioral, or mental health challenges and the families that support them. And we do this in a variety of ways. I want to go over just a little bit of what we do so that you have some perspective about what ACMH does once we begin the discussions around funding, so you know what we are seeking funding and how it ties to what we do in-house. So one of our core roles is serving as the statewide training and coordinating partner for the Michigan Department of Health and Human Services. So this is our state department, and it's our partnership with them. Our organization trains and provides ongoing support for our parent and youth peers in the state. And we also work with the department to expand the peer continuum, and currently that is expanding into developing crisis peers. We also work closely with our communities and systems across the state to strengthen services, improve supports, and ensure that family voice is really at the center of all systems change efforts. We do this through delivering educational content and webinars at conferences and at community events. And we engage youth and families through our parent and youth advisory committees, where we help develop leadership skills and connect youth and families with opportunities to lend their own voices and experience. ACMH is also, as Dana mentioned, Michigan's federally funded statewide family network, and we're supported by SAMHSA as well to help families navigate mental health challenges. And we serve as one of Michigan's chapters of the National Federation of Families. Now that you have a little background of what we do, just take you briefly through what we'll talk about in my section. We're going to look at funding, at our funding specifically, the importance of relationship building, some sustainability components, and then some tips and tricks around reporting and grant writing. And I think from the experience that we saw in the poll, most of you likely know what diversified funding streams means. But just to give you, just to level set, if you can go to the next slide, please, thank you. It just basically means that you have funding coming from multiple sources, that you don't want all your eggs in one basket. So there are 4 broad categories where family-run organizations can find sustainable funding. And we're going to walk through some examples of each of these. Government funds are often the most stable, but they come with the most accountability. And we know as things are changing in the federal landscape that the type of funding that you currently have may or may not be. So there may be some people who have been impacted, and we are one of those organizations that have been impacted by the change of priorities at the federal level. But by and large, government funds are often the most stable. And you think about things like contracts and outcomes and reporting being very tied to government funding sources. Federal grants can include those that are relative or relevant to family-run organizations. Those can come from SAMHSA, HRSA, the Department of Education. the Administration for Children and Families. These are all good places to seek out funding opportunities. There are project-based funding with clear deliverables and timeframes, and they're often competitive but impactful. There are state contracts and grants like we hold with our MDHHS, and these are often tied to service delivery or policy partnership, and they can be renewable, but usually they require detailed reporting as well, almost on the level of federal grants. It looked like some of you do generate revenue through Medicaid reimbursement. So if you're eligible, this is another source of funding, and it is part of service delivery. ACMH does not provide any direct services that are Medicaid reimbursable. But in our state, it requires that you have partnerships with the community mental health agencies and you become a provider yourself. So there are some things that you need to do to establish your organization to be able to do that. County and local government support is also a potential. They're usually smaller grants or contracts for programming, prevention, and outreach. And these are often overlooked, but worthwhile to seek if you are looking for some alternative funding sources. In contrast to government funding, there's private funding that can support other things like innovation and capacity building or even general operations. You can be looking for foundation grants that can be local community foundations and even national organizations that are focused on mental health, youth, or family advocacy. And these can vary from one time to multi-year funds. But also don't underestimate your local businesses. They're often looking for meaningful ways to give back. So you can have corporate sponsorships or corporate social responsibility partnerships that can be especially useful. These can fund things like events and awareness campaigns or youth programming. And they might include funding that's in-kind donations or even volunteer hours. That's a source that can, those hours, even though they're not monetary, they're something that can help your organization by providing you with less that you have on your plate and the capacity of your staffing. And this type of support also builds long-term relationships with mission-aligned businesses in your communities. So when you're seeking those businesses that you would like to partner with, you need to go to their websites and look through what are the priorities for their funding, and does that align with your mission before taking the time to reach out to them and establish those relationships. You can also benefit from individual and community giving. And these donors are crucial for unrestricted funds most of the time. So even small, consistent giving can add up, and it can signal a strong community support. So individual donors may give one-time gifts, recurring monthly gifts. It could be a memorial giving, and there can be major gifts that come from philanthropists or local champions. And they're often relationship driven. So they might require a more tailored cultivation strategy where folks get to know your organization and can understand the benefits that you bring to your community. It can be planned giving, such as legacy gifts and wills or estate planning. And those also are more long-term, but those can be powerful sources of funding for your organization. And then you can get into fundraising events like walks, galas, family fun days, auctions. These types of activities serve double duty as raising awareness and generating revenue. And one thing that I have learned is it's a good rule of thumb that your investment into your fundraising event should really stay within 30% of the total amount of funding that is raised by the event. Then we have earned income opportunities, and these streams build sustainability and independence. Plus, they grow your brand and your reach. So you can have training or technical assistance contracts that offer services to other organizations and agencies, such as providing toolkits or specific webinars that you host. They're a sustainable source that build your reputation and reach as well. And then you may have merchandise or resource sales that include branded apparel. This is low overhead and it can be a meaningful source of funding if it is scaled right. And then if it's applicable, you might consider developing a membership program where you offer other benefits and resources to members for a small fee. And that can build community and steady revenue. We'll take a quick look at the funding that was present at ACMH when I began in 2023. We had government funding through SAMHSA and our statewide family network funding. We had mental block grant funds that are federal funds that came through our State Department, as well as ARPA COVID funding that came through the state. And then we had private foundation funding through Gerstacker and Flynn Foundations and individual donations from the community, but also from some organizations as well. No earned income, however. And I thought when I was stepping into this as a new ED that we had a stable funding environment. And I learned very early on how important relationship building is in this process. You don't want to take your funding for granted, that's for sure. So we'll jump forward to currently what our funding looks like in 2025. In just 2 years, it looks very different than it did in 2023. So we still have our SAMHSA funding and we have mental health block grant funding through the state. But we've also secured new contracts with actual state funding, expanding our reach and our impact. We did lose our ARPA funding with the cuts at the federal level, but we were anticipating to end that funding source in September of this year. So we just had to shift to an earlier timeline. We no longer receive funding from the Gerstacker Foundation. And we added a few other sources to our private foundation funding, as you can see here. That said, we've made meaningful progress. We've expanded our private funding, and in a big milestone, we hosted our first fundraising event since I began in this role. So we live in a dynamic world, and this constant change demands that we stay flexible and strategic. Most funding sources are not guaranteed, as I mentioned. And even those that are stable may still require you to reapply through a competitive RFP process. And it's why it's so important to diversify your funding streams, not just to grow, but to weather the inevitable fluctuations that are outside of your control. And if we look a little bit deeper at how our funding has shifted, I want to highlight why relationships matter. So over time, we experience losses and gains. And one of the ones that stands out the most is the loss of our Gerstacker Foundation funding. And that occurred when we had a transition of leadership, and we lost the essential relationship that was a personal tie to the Gerstacker Foundation. And this is something that you want to be aware of when you're developing relationships. Succession planning and shared stewardship are essential for sustainability. You don't want a relationship that is bottlenecked on a single individual to make or break whether or not that funding is sustained. And so you want to bring in other staff members to participate in that relationship building so that as people transition, and they do, that there is a plan and a stronger relationship that's built with the entire organization. And at the same time, we strengthened other relationships, most notably with MDHHS, and that led to new state contracts. So we have a peer expansion and a crisis peer project that were added. And one of those projects focuses on expanding our existing parent and youth peer programs, and the other extends the peer support continuum into crisis response. These new partnerships reflect the state's trust in our organization's ability to provide professional, consistent training and support. And as a result, MDHHS continues to partner with us to ensure that lived experience remains at the center of this important work. We've also expanded our network of support beyond government contracts, and we gained recognition from the Herbert Foundation, Michigan State University's Society for Human Resource Management, M-Heal Echo at the University of Michigan, and Case Credit Union. So these growing partnerships reflect an increasing awareness of our mission and the value of lived experience in shaping systems that truly work for families. And I just want to point out the M-Heal Echo initiative, they haven't donated funding, but what they have donated is their time. So they have a graduate project that is centered on building out a part of our website focused on resources. And that takes a heavy lift off of our organization to have to develop that. And it gives them a graduate project to also be able to show at the end. So that is just another way to think about how you can interact with community partners. So how did we do this? How did we focus on building trust and in our organization and in our brand? So we invested time and energy into relationships. We embraced a dual strategy, a bottom-up approach rooted in community presence, and a top-down effort to broaden visibility and credibility. We showed up. We attended local community events, joined committees, participated in work groups and advisory boards. And we sought opportunities to present webinars, provide technical assistance, and speak at conferences. Any chance to connect, collaborate, and demonstrate our value. We also invited others into our work. For example, we're currently co-planning a Youth Mental Health Action Day event next week, and we're doing this alongside Youth United and the Detroit Wayne community. And this is an effort grounded in shared purpose and collaboration. And just to give you a little scope of this, the event planning is upwards of $13,000 for one event. And by collaborating with these other partners, our portion of that is under a $4,000 investment. But it's something where we are able to really expand the reach of not just what we can provide at the event, but we pull in all of the communities from those partners too, and we increase the base of the people who are in attendance and who the word reaches. So there is a huge effort in being able to collaborate with other community partners that you have in your state. And over the past year, ACMH also underwent a rebranding initiative, not just with our new logo, but with intentional internal work to ensure alignment across our mission, values, and the people that we serve. And through that process, we were reminded that it's not enough for people to recognize your brand. They need to trust in your brand. And that trust is what opens doors to deeper partnerships and sustainable growth. We also build trust by intentionally investing our time and relationships with other key stakeholders. Our connection with the peers we train and support is essential, not just to ensure we're delivering up-to-date best practice training and support, but also to stay informed about the evolving needs of our communities and the peer profession itself. These relationships, they aren't just important, they're generative. There's a ripple effect with every connection we make, and it's bi-directional learning. We also prioritize time with provider organizations, so our community mental health organizations and their contracted providers, so that we can better understand the barriers they face and how we can be a partner in supporting their efforts and ensuring the success of peer professionals. The same goes for our work with supervisors. We listen to them, we learn, and we adapt to better serve the entire peer support system. We also invest time in maintaining the integrity of our contracts, meeting deliverables, communicating openly, and striving for transparency. This can mean navigating tough conversations while maintaining professional expectations and always assuming good intent. So I'll be honest, this can be one of the hardest things to do when people don't see eye to eye, especially when most of our work is in response to the gaps and challenges within our systems. But it is really key to be able to come to the table and have dialogue around those differences so that you can work through and come to some agreed upon solutions to move forward. So how we manage that, that's another topic for another webinar. So I hope it's clear and that what you're taking away is that relationships are at the core of what we do. And as we think about sustainable funding and organizational growth, we also want to ask, well, what else matters? It's not just relationships, right? When you're seeking out and adding new contracts or grants, capacity and sustainability must be part of the conversation. Do you have systems and procedures in place to work efficiently and meet timelines? Is your employee manual clear and up to date? It sounds like it is random and doesn't fit in this, but your HR management can be very time consuming in what you do. And so you want to make sure that you have a robust employee manual to refer back to. That's important to have up front. Do you have standard operating procedures that guide consistent service delivery? Do you have a reliable internal reporting system to track progress and stay aligned with deliverables? And we'll talk more about that shortly. And then look at your staffing and training needs. Is this a completely new area that you're applying for that requires developing internal expertise or something already within your organization's strengths? What kind of training or onboarding will staff need to ensure quality implementation? And do staff know how to utilize key technology like shared documents, SharePoint, or project management tools? And then don't forget the power of cross-training. Do you have coverage if someone goes on leave or takes time off unexpectedly? Sustainability isn't just about securing funding, it's also about being able to keep going when things shift. Leadership development is another critical component. You want to build up a strong leadership team and then trust in them. Delegate. You cannot and should not do everything. And then finally, my experience is that supervision really matters. It should occur weekly with a clear hierarchy in place so that staff know where to go for support and so that you're not at the center of everything. Meetings should be intentional. So you want to have a consistent protocol for reviewing project objectives, discussing progress, identifying next steps so that you can keep work moving forward and aligned. And then let's take a little closer look at the reporting systems because grant reporting requirements can be incredibly time consuming. And if not managed well, they can be very overwhelming. So you want to ask yourself, do you have a system in place that works? Is one person responsible for reporting, or is it a shared responsibility across staff? And we've actually done it both ways. At one point, we had a staff member who was solely responsible for entering all the reporting data, and the rest of the team would send her their updates and she would compile everything. But when she had to take an unexpected leave of absence, I was the one thrown into the fire, and it quickly became clear that it was not the most efficient or sustainable setup. So we transitioned to a collaborative reporting approach using Microsoft 365 tools like shared documents and lists and folders. And it was a shift, but it's been worthwhile. And to make any reporting system effective, you have to consider a few things. So your staff needs training, likely. Do they know how to use the tools? There needs to be clear structure. That's critical. Where is each person contributing? Are there specific places assigned to each staff member? What are the rules for collaboration? What are the expectations when multiple people are editing or inputting data? And some thoughts around why collaborative reporting works is it builds trust. It shows your team that you respect their work and their expertise. It increases their understanding. Staff gain insight into why behind the work and see how their contributions fit into the bigger picture. And it guides the work. Reporting becomes more than just a task. It becomes a way to identify next steps and address barriers in real time. And then, of course, there's the content, the meat and potatoes of reporting. So I've met many people who feel intimidated, honestly, even terrified by data. But it doesn't have to be scary. At its core, good reporting answers just a few key questions. What did we do? You want to stick to the point, no fluff. What did we actually do that aligns with what we said we'd do? Who did we impact? How many people were served and in what ways? And did the funding achieve its purpose? That's what funders are ultimately asking. Did these dollars lead to the intended outcomes? And that's the measure of success. And a solid reporting system helps you to tell that story clearly and confidently. So I'm going to just briefly go through some grant writing tips. And next month, we're going to go a little more in depth about this. So you may still have some more questions. And hopefully, in these 2 sessions, we'll cover some of it. But here's some things for you to take away for today. Sometimes, the writing part is very daunting, and parts of sustainability include the grant writing process. So you want to start with alignment. And this comes full circle to what I opened with. Before anything else, you want to ensure that the funding opportunity aligns with your mission and organizational capacity. It's not a strong strategy to chase funding and then try to mold your work to fit the grant's requirements. That kind of approach often leads to mission drift, burnout, and unsustainable programming. And most of us have heard of SMART goals. You definitely want to build SMART goals. And once you've identified a NOFO or RFP that you want to pursue, your next step is to craft clear SMART goals that align with your organization's work. So they need to be specific, well-defined and focused, measurable with criteria to assess your progress, achievable given your time and resources, realistic with your mission and values, and time-bound with defined start and end points. And these goals not only strengthen your application, but they should be guiding your work if you're funded. Then you want to assess your capacity. Do you currently have the staffing and systems in place to meet the proposed goals? If not, determine whether the grant supports adding staff, including salary, fringe benefits, in alignment with your internal practices. Like, for example, does the fringe rate of the grant cover insurance and paid leave, right? You need to be looking at these specifics. And if you're not adding staff, think carefully about other competing priorities and whether the organization has the bandwidth to take on something new. And you want to use technology and do your homework. Once you're in writing mode, lean on technology and research tools. You want to read the NOFO or RFP thoroughly, and I do mean all of it, and it could be very long. And you want to look up any supporting documents or appendices. SAMHSA, for example, has extensive supporting materials, and this could be hundreds of pages of reading, and it's all worthwhile. Research anything that's unfamiliar, any terms and background of topics that you're going to discuss. Don't guess. Back up your proposal with real data and evidence. Attend relevant technical assistance webinars when you feel that you need additional support. And these measures help to ensure there's a clear link between the need you're addressing, the work you're proposing, and the way you'll measure success. And last, AI can help, but you want to double check everything. So AI tools can be a helpful starting point for idea generation, organization, or even formatting, but they're not always accurate. Always review and fact check any AI generated content, especially citations, statistics, or claims. So now let's put all of this information together. At the end of the day, sustainable funding isn't just about money. It's about alignment, capacity, and trust. It's about building strong internal systems, cultivating meaningful relationships, and staying grounded in your mission, even as you grow. The key is balance. Know your strengths, stay true to your purpose, and nurture funder relationships as partnerships, not just transactions. When you invest in people, including your team, your partners, your community, you're also investing in the long-term stability and impact of your organization. And that's how we build systems that last. And I have mentioned all of the funding that supports our work, but it is key to always bring recognition. So as I mentioned, we are funded through SAMHSA, MDHHS, the Flynn Foundation, the Herbert Foundation, and other generous donations. And you will have my contact information that we can skip over because Ricky has a wealth of information to share with you as well. So I want to move on quickly so that she can jump in and take over. Thank you so much.
Thank you, Carla. That was great information. I appreciate you kicking us off. I'm going to dive right in, you guys. Thanks for joining. For those of you who have joined, you are like me. You love to learn and you want to learn something out of this presentation. So I want to talk to you a little bit about moving yourself and your organization from a legacy to focus on longevity. And with that, we'll dive in. I think right now, as a whole, behavioral health is at a crossroads, and particularly those crossroads are, we have a rising demand for service and a shrinking workforce. And that brings us to a point of needing to address workforce shortage through our organizations, through culture, through retention, through learning, all the things. And oftentimes, as a leader since 2011 of a family-run organization, I've seen over and over again that our best feature as family-run organizations, our most unique factor, is the amount of heart and compassion we bring to our work. But sometimes that leaves us without the business strategy to get the work done. And so my hope today is to help you think about how you can continue to bring heart and build your business strategy. And with that, I want to talk a little bit about what is pushing us into those difficult places: workforce turnover and burnout. You all probably know just as much as I do, if you're leading teams, that we are always thinking about how we can support our workforce through it. For us at Tennessee Voices, it's always promoting self-care to try and reduce burnout, but always thinking about how we can retain the staff we have through learning and growth opportunities. And we have this constant rising demand for service and change and adaptability. And change and adaptability are hard for our workforce at times. When we change and adapt, we have to be efficient in doing that. And when we build in efficiencies, we have to have resources to do that. And so funding becomes difficult when we try to change or build efficiency and transition. There's always, if at least for Tennessee Voices, policy shifts through the entire life cycle of a family-run organization. We follow changes at state, local, and federal levels. And so our business model, our business strategy has to be nimble and ready to adapt to those changes. I'll say, as a side note to that, I don't think it's always a bad thing. I think change and flexibility forces us to think about how to innovate and how to continue to grow and stretch ourselves to do the work. As we do that, I think the real strengths of a family-run organization, back to the heart, we're mission-driven and value-centered at the heart of everything we do. We're doing it for families, with families, by families. And I think we build community trust in what we do with the people who need us, because they trust the fact that we have an organization full of people who understand the need at a very deep and different level. This demands we have great relationships. Carla has already touched on this. I won't overemphasize, but I do want to emphasize, at least for a moment, how important these relationships are. These relationships are with our communities for whom we serve, with our staff, and with our funders. And I think the strength that we bring to this is we have this, I don't know where it comes from, but I've never met a family-run organization leader or staff member who doesn't have this deep drive, this drive to do more for families. And I have to say, it's got to be from that experience that we have, that we've all lived through something we don't want anyone else to have to feel or live through. And so we've all got this drive. We can channel that drive, and that passion can become fuel for growing our organizations and developing a strategy. I think we have to also think about how we handle leadership in our organization, because leaders really set a tone here for where the organization can go. I'll explain in brief a principle that I really like to live by. John Maxwell wrote a book on many books on leadership, but one of them is the law of the lid. And in this principle, the law of the lid, it really talks about how wherever the leader is, if you measure a leader 1 to 10, if they're at a 4, the organization cannot surpass them. If they can make it to a 6, everyone rises with them. And so there has to be this focus, I think, on developing the leader of the organization. And then as you develop, the leader develops more leaders within the organization, and everyone continues to rise. I think we also have to think about then, what is our pipeline? What is our planning for the future? How are we setting ourselves up for future success? So if we are growing ourselves as leaders and then growing others as leaders, we should be thinking about succession and longevity beyond just my time leading the organization, but into the next 20 years after me leading the organization. And we have to plan. We have to plan to have the resources long-term and to address the gaps we currently have to innovate. And I'll get into innovation later, but I think if your organization isn't looking right now on innovation, I think the future gets really blurry. So sustainability, our favorite word in any grant application, sustainability. How will you continue this after we take the money away and you continue on without this support of this funding? It's a very important word, but I think one that we often just sort of gloss over, especially when we're thinking about our business strategy for sustainability. So I want to talk about a couple of things under this: financial health and mission alignment. I think there has to be financial strategies at the organizational level that support the longevity of the organization, but stay aligned, as Carla mentioned, to the mission without creeping into other things. Oftentimes, I will see sustainability ideas that chase the money available instead of the mission set forth by the organization. And so I try really hard to keep my team thinking about how we're going to accomplish the mission and not to get focused or move our focus over to areas where there's financial opportunity. In order to do that, we have to make sure we have financial health and financial plans for our future. So I will say a tip here: a really great board can help you so much with this. Be intentional about the board members that you need for the health of your organization, and particularly choose those folks who have a background in financial sustainability, business strategy, investments, anything that can help you understand and build your knowledge around how to sustain the organization for the long haul. And then build operational resilience. So create standard operating procedures, but get great people in place who understand operational efficiencies, operational needs, and can be really resilient with change over time. I cannot tell you enough how important it is to understand how to look at your business in segments. If you're an ED, maybe thinking about operations, finance, HR as some of your major pillars that need to have great leadership, foundational leadership that can help you move your organization into the future. And then innovation. Innovation, here we are. I can't tell you enough how much I think innovation is going to be the word of our next 5 years. I do think our models are being challenged, be it good, bad, or indifferent. They're being challenged, and we as leaders have an opportunity. We can either be really frustrated and be distracted by those changes and challenges, or we can take the energy that we might use on frustration and channel it into innovation. And I choose the latter, because I think if I use my energy toward moving into innovation and moving into change, I feel it prepares our organization for the future. And so here's some of the ways I do that. I look at some of the decisions that are currently being made in our industry, And I read and understand the minds of the people making those decisions to try to predict what they are looking for. What do they want to actually accomplish out into the future? And then I back into that with solutions that I think will help get those needs met. And often I find that we're trying to meet the same goal. We're just thinking about it differently. So I encourage you to deeper dive into decisions that are made from leaders, stakeholders, government leaders, all the things that are happening right now, to deeper dive into the why behind those decisions and see how your organization can adapt and change and be nimble enough to meet some of those needs. I think there are a couple of things here. So what we really need to be thinking about in a family-run organization, in my opinion, include this sort of graphic here to help you understand that as a leader, you got to be focused on all of these areas. And to Carla's point, you can't do all of this alone. So you need a leadership team around you who can kind of manage the segments of this work. Financial sustainability, financial health is your avenue. That's your vehicle to getting you to the mission and the vision that you have for the organization. And so focusing, as Carla's laid out for you, on the opportunities you have for different financial streams, diverse financial streams, it's going to be core to how you get where you want to go. Defining your vision values and sticking to them as you seek financial sustainability, so critical, as I've already said. Leadership and succession, taking care of yourself as leader, continuing to learn and grow as a leader, and putting great board members for governance around you that can help you grow and learn is critical. But while you're learning and growing, you've got to be bringing your leadership up with you. So planning ahead for your departure, because one way or the other, you will not be here forever. And the people who need to keep going need to be ready when you're not there. And then workforce strategy. We'll get into at a few slides how important culture is to your workforce development and retention. But your strategy for your workforce is critical, and you need to have a team helping you think about this critical need. And then lastly, innovation. As I've said, we won't harp on it, but be thinking about your innovations and have an attitude in your organization toward innovation. And here's just briefly what I mean by that. Make it okay for people to share new ideas. Actually make a day of it. This year, we have a day to innovate planned for our organization. We actually have 3 important days in the life of our organization. We have a day to advocate, a day to innovate, and a day to resonate. And I can explain all those later, but if you're interested, you can always email me after and I can tell you more. But this is important, to create a culture where ideas can be shared and they can be heard and they can be considered deeply in your innovation strategy. All right, staff burnout and trauma. I want to talk a little bit more about culture and how we create culture to avoid the burnout and the secondary trauma that our staff experience in doing this work. The first of which I think is building a culture where self-care is normalized. And by that, you can do a couple of things. One, model it. As a leader, make it okay to take time for yourself, to use your PTO, to not overwork and overstress, and to have mental health days available for your staff. Very simple, but make PTO time. Someone can take off if they're sick, but they can also take off if they need a breather, if they need to go away from work for the day. And I think we all sort of own and accept these things, but we have started to integrate this into our policy so that we do have sort of a norm of taking time for yourself, your own mental health. And then create opportunities for people to learn, grow, and promote within the organization. People are really attracted to a thriving organization that has opportunities to grow them. Investing in continuous education for your staff is one of the best things you can do. Most people want to learn and want to grow. And then create retention and recruitment strategies that help you by doing things like honoring longevity. and here we are back at our longevity word, but honor longevity through longevity stipends, bonuses, longevity recognitions. We do annual longevity payments. We also do a sabbatical for your longevity. So in our organization, at every 5-year mark, you get time off, free extra PTO. So it's 2 weeks at 5 years, 3 weeks at 10 years and on. And with that, a cash bonus so that you can take the time to do some self-care things. And we don't define what that looks like for people. Everyone has their own unique needs, and so they should have their own opportunity to use their cash to support their self-care in the way that they feel is appropriate. But that's just a very simple way to focus on retention, to keep your culture alive around self-care, and to promote longevity in the organization. Okay, so as we've talked about, there are some opportunities here to create sustainability in workforce. And I want to just mention another one aside from what I've said. There are some fantastic universities in our state where we've been able to create internship pathways. I encourage you to do this. If you don't have relationships with universities, make it known that family-run organizations are interested in internships. They are a place for long-term work, that they should be part of the presentations in the classroom in terms of how people are understanding what the behavioral health field looks like outside of school, and then create opportunities to invite those interns to work within your organization. I will say so many of our interns have stayed on with us post-internship or come back to us when a job was available. And this is a great way to introduce someone to the field and recruit them into your organization. Keep in mind, trauma-informed workplace culture continues to be very, very, very strong. There's a lot of research around this. If you're not already doing it, ensure that you're using careful trauma-informed language when you address your workplace or your workforce rather. And then leadership and supervision investments. I want to add here a plug for something that really helped me and my leaders in my organization. The Clifton Strengths Finder is one of my favorite tools that we have used as an organization to really understand each other's strengths and use those strengths to benefit the organization and the staff person so as not to burn someone out by making them do things that they really aren't equipped to do, and to also get the most out of their skill to support the organization and mutually benefit from, yes, I see the comment, yes, I really do. And I'll say one last thing on Clifton's, and I don't sell Clifton's or anything like that, but I will say it is the one tool that I've found that is not focused on a person's deficiencies. It is so strengths-based. It's so aligned with our mission as family-run organizations, our culture in family-run organizations, to be strengths-driven and to say, you are great at these things, and that is what lights you up and gets you excited about work. That's what you should be doing. And anything that falls in that bottom non-talent section should be for someone else who has those talents. It doesn't mean you need to go figure out how to get those talents. And I love that about the Cliftons. All right, innovative pathways. Here we go. This is my favorite part. Innovation gets me excited and gets me thinking about the future of our family-run organizations. If you're not already thinking about tech, telehealth tools and digital tools, there is a lot in this space. I encourage you to think about what might be helpful, but critically evaluate how much they create efficiencies in the organization and how much they could create big speed bumps for you. Tech tools are coming at me all the time. I don't know about those of you who are leading organizations, but between the amount of emails and phone calls of people calling on me, wanting me to use their new behavioral health technology, it's really hard. And it makes me want to just shut it off and say, no, thank you. But what I've learned to do is really think about what we've said in our strategic plan that we need to accomplish, and then evaluate, are there any efficiencies we can use, any tech tools we can use to accomplish those goals, and be laser focused on what I look for and not get too caught up in the noise of a very big sector. And then cross-sector partnerships. You would be surprised if I told you how many partnerships, MOUs, agreements, and ideas we've shared with other partners. Collaborative is a word in our mission, and it's a word we live by. And we have done some of the most exciting work in our life of our organization when we've done it in partnership. So I encourage you to keep a really deep connection with other people doing work in your industry, in your field, working alongside you, develop long-term relationships. I'm going to give you a quick example of how one of those long-term relationships paid off, and I hope it encourages you to stay engaged in any of those relationships you have with your colleagues. The example is this: when I started as the CEO 11 years ago, I met a woman who also became CEO in nearly the same month in the same year that I did of her organization. We in Tennessee Voices, we were the national chapter state chapter of the National Federation for Families. This woman was the state chapter of the Prevent Child Abuse America. And so we sort of connected and said, man, here we go. This is our first role as CEO. We're kind of finding our way. And we had lunch every couple of months just to say, like, how are you doing? How's it going? How are you growing? And we learned from each other and we supported each other. And we oftentimes would support each other's events or ask her to speak at a conference we had, or she'd ask me to attend. And we relied on each other. We worked together. It was great. In January of 2025, we combined our organizations, and the organization which she led folded into Tennessee Voices, and we are now one big organization. So we have today, Tennessee Voices has 250 employees. When I started, we had 20. And I would have never imagined in that beginning month as a new CEO with 20 people that just 10 years later, we would be here, 250 people, and having combined with another organization. But these are partnerships that can take you places you wouldn't imagine. So I deeply encourage relationship building and partnerships. I don't recommend that if you don't know a partner deeply, you merge. But we did know each other deeply. We spent 11 years around each other, and we knew our missions were aligned, and we knew our culture was aligned, and our values were aligned. So my encouragement to you, think about your partners in ways you might not have thought about them before. Make sure that you have a focus on your ability to get data. I will say you don't have to have sophisticated data to tell you things that you might want to know as a leader of an organization. Start somewhere with data, collect information, and be able to look at the data you have to tell the stories and build on it. Just build on it each year, add a little bit more, do what you can. I know it seems expensive at first. You don't need a sophisticated Harvard researcher to get you started. You might end up there, and kudos to you if you do, but to get you started, you just need some information that you can start collecting and building on. So don't neglect that piece. For the sake of time, we'll keep going. Make sure in your culture, as you think about innovation, you create some psychological safety so that you can gain from the creativity being shared. A lot of times we're scared to be vocal and share ideas if we haven't experienced psychological safety in our organization. So, my encouragement to you is just to ensure that you're building those safe avenues to share without repercussion, and to get feedback loops going, to make sure you have any kind of tool. We like to use a tool called Intergage, which is supported by top workplaces. Any loops for feedback you can get where people can share things with you, share ideas with you. Complaints are a gift. And I'm really not even talking about complaints here, but I'm just going to say that to you today, that learning what is bothering people inside your organization helps you as a leader know how to address those things. And when you do address that, it creates psychological safety in your organization, because people now believe that I can share something and it's held, and I'm not punished for it. And sometimes, if appropriate, it gets addressed, which leads to creativity, because then they start to feel safe enough to share their ideas with you. Make sure that you have the opportunities to co-design with staff and community. So once you do have ideas and they are shared, invite those staff in to help you think that through and plan it out. One of the best ways to do this, to co-design with staff, is around the strategic plan. We invite staff to help us when we get our strategic plan started, and work in a committee to help us think about all the parts of the organization that as leaders we don't always have eyes on every day. So this is really critical to include them. Lastly, I will say, you have such an advantage as a family-run organization to invest in your workforce, because you've already built in this compassion culture, this culture of understanding, this culture of lived experience that then honestly can almost lay the groundwork for psychological safety. And one of the ways that we grew beyond that piece was to build a peer support coalition in our state. Tennessee Voices was able to start with the coalition. We sort of facilitated the beginnings of a coalition of peer providers in our state who could all come together from different organizations to share learning, to share experience, and to share support. This became really critical for peer support providers who might have been the only or one of a few only peer support providers in their organizations, where they really felt like maybe the organization didn't understand their work fully, or they were kind of alone in their role. So this created peer opportunities for them. We don't now facilitate the coalition. The coalition is now governed and led by the members. So peer providers from all across the state, multi-disciplines, multi-organizations, all now participate and govern themselves in this coalition. And they do phenomenal work in sharing jobs about what opportunities are available for peer support providers, what learnings are available, trainings are available, and how they can continue to grow. So they've kind of created their own little life cycle of helping each other. And then through our innovation pathways, we've secured new funding through partnerships. So we had an opportunity to partner with other organizations who had funding that wanted peer support services included. And we raised our hand and said, well, we're experts at that. That's what we're all about. And we can do that in your grant that you're proposing. And so we have multiple funding streams where partners applied for grants and wrote us in to deliver the peer support care. That's a really great way to begin to innovate and do work outside of your organization. Okay, my timer just went off, which means my time is up. So Dana, if you'll go one more slide, I'll just wrap up so we can leave enough time. Perfect. I cannot reiterate enough what Carla said. Focus on diversifying your revenue streams. Make sure your budget aligns with your strategic plan, mission, and goals, and make sure that you have board members on your board who can help you understand how to build reserves through investments and opportunities to gather data and track your impact, so that you can start telling your story, so that you can get more funding and more diversified funding streams.
Thank you so, so much, Ricky and Carla. That was just such a great wealth of information. And everybody, you are in for such a treat, because both of these wonderful presenters will be back with us next month to dive a little deeper into grant writing and the family peer career ladder. But right now, I'm just going to skip ahead a few slides, and we were going to do a quick breakout room, but I think it might make more sense to leave time for questions, because I imagine we have a few, and we can do this as a reflection activity instead. So we have two questions for you, and I'll give you a few moments to kind of noodle on those, and then we'll open a Mentimeter poll so that you can tell us what you think. So Carla and Ricky both talked in different ways about the various funding streams that are available. And they generally fall under these like 4 buckets, but we have a few more. And we're curious which funding streams you feel are most underused in your organization. And when you get to that Mentimeter poll, pretty sure you can only pick one again. So you can just pick the one that's most underused. But if you want to take notes for yourself and think about all the different types. So Carla, when she was mentioning government, she said state, federal, local, private, you have the foundation, you have sponsorships, community, you have those individual donations, earned income, that's merchandise, toolkits, trainings that you're delivering. So which is your organization not tapping into quite enough? And then what relationships could you start building right now? We're going to go back to our Mentimeter poll. So again, you can go to the link that Lachelle and Gina have put in the chat, or you can go to menti.com and type in 224-4357. And I'm just going to head over there so that you can input your answers to those. Which funding stream is most underused in your organization? Federal grants, foundation grants, state and local contracts, Medicaid reimbursement, private insurance, corporate giving, donations, earned income, or something else. I'm just going to quickly go to the next slide so folks can start entering their relationships as well. This, you can just type in a word. So what relationships could you start building right now? You could talk about one of those categories, or you could say some specific relationships that you would like to build. But just take a moment to think about those questions. And if you're having trouble accessing the poll, you can also share your thoughts in the chat. Looks like a lot of folks are feeling that donations are underutilized. A few people would like to get more familiar with corporate giving, foundation grants, and federal grants. Others want to tap into that Medicaid reimbursement and private insurance payment streams. Great. And keep on answering that. And if you answered other, please share in the chat. What else are you looking to tap into? Let's see what relationships we're building. Keep answering both those questions. Again, we'll share the results in the slideshow when we follow up. Community relationships, business community, private foundations, corporations, community leaders and philanthropists, earned income relationships. Great. These are all great. Lots of folks are looking for community relationships. School districts, yes. Yes, the community relationships will lead to corporate giving and foundations and donations. Great. Excellent. All right, as you're finishing up your responses to those questions, we want to think of what other questions do we have for Carla and Ricky about funding at the state and national level. Hospital relationship, great. So I'm gonna take myself off spotlight and get us all together. And then please, let's raise our hands or type some questions in the chat. And what do we want to ask our very, very wealth of knowledge presenters about funding?
While people are thinking, Dana, I might just share something really quickly that I think is critical and I didn't specifically touch on, but building relationships with your Medicaid provider is really, really important so they understand what you do. I know every state's different, and you all are coming from very different places in terms of whether your services are billable or not in your state. We could probably do a whole talk on sustainability planning with Medicaid. But you should be always seeking to figure out how to bring your services into the fold of what's Medicaid approved services. When I started in 2014 as the new CEO, we had been building toward that for many years. I was fortunate enough to be able to get in my seat and within a few months land our first contract for family support services, billable family support services. And since then, we've now been able to work together with our state to get our high fidelity wraparound services now into a billable code for Medicaid. It took years of demonstrating the outcome of that work. And so don't ever give up. Always be working on that approach because that is a long-term sustainable earned income opportunity.
Absolutely. Thank you so much for sharing that, Ricky. So Amber wants to know, what is a good way to reach out in my community or professional network for advice or mentorship? That's a great question.
Well, I'll be happy to say when I was a new CEO, I reached out all the time to people for advice and mentorship. So the first step is being willing to ask for help. And I think that's huge. And I'll say, people who have been successful, they love to be asked how they did it because there's stories to share and they didn't get there because it was easy. And so I think it's flattering. So don't be scared to approach speakers at conferences that you meet, people on your board that you think are doing well, to just say, hey, could we grab coffee? I'd love to learn from you. It's one of the most flattering things you can ask of someone is, can I learn from you? Can you teach me how? But be specific. Don't just say, how did you get here? Ask them specifically what you want to learn and find the people who have done that thing so that you can trust their answers.
I agree, Ricky, and I did a lot of that myself over the past couple of years. Just when you are around people that you see qualities that could impact the work that you're doing, really having that specific ask is important. And being a part of NFF activities will give you a lot of exposure to different leaders with diverse strengths across the country, right? And so that is another way to get exposure to even know who you might want to ask. But if you want to look more locally, people that you might have an opportunity to meet in person, I think for me, it was mostly the conferences that I attended, and that was where I gained the most exposure to people who I sought for mentorship.
Excellent answers. Yes, I was thinking along the lines of Carla too. I'm not sure, Amber, if you are a part of an NFF affiliate, but we at NAFSTAC can also facilitate some connections if you're looking for someone in a certain field or with a certain expertise. And Gina has very helpfully put our technical assistance request form in there. So if anyone is looking for mentors, that is something we can facilitate. So make sure to turn that in. We have another question from Tammy. Any tips on ways to stand out for funding requests when so many other organizations and entities are doing the same thing right now?
Well, Tammy, your unique proposition is that you're a family-run organization would be my guess. I tell you, this is our number one selling point. When people understand what family run means and we spell it out in a grant request, they start to get the picture that we have folks in our organization, supportive or clinical, that are all focused on lived experience being part of the equation. And that is the unique proposition for us in that we can create better engagement for the families. because we have people here who walked their walk and have been in their shoes in similar ways. And we just, our outcome and engagement is often stronger. So we talk about that all the time. I think it's your unique proposition for being family run. Carla, I'm sure you all have all kinds of ways to get here.
I agree. I think that tapping into that lived experience is a huge pro in your application. And I would say just having a strong application in general. And so if you're not as familiar with grant writing, and even when you are, there is always more to learn. And there are often community resources that you can tap into, right? So you're here at this technical assistance. That's one way to get additional support for grant writing, right? We have another one next month that NAFSTAC will be hosting. But universities often offer other grant writing support, or if you have funding to contract someone to help, it is worth the investment of time and resources to really ensure that your proposal is strong. And some of those key elements are making sure that you're clearly articulating what is the need, that your goals are strong to address the need, and how you are going to implement what you say that you're going to do. I think that's really key in what funders want to see is you need to connect all of those dots in a solid way. Otherwise, face value, your application doesn't come across as strong. So that no matter what it is that your strengths are, you need to be able to articulate that very well.
No one else has any questions. I have one from a registrant that might be a good closing question. You both talked briefly about foundation funding, and I believe Carla, you mentioned, or it might have been Ricky, that sometimes they want to give you a pilot program funding, and then they want to see how you take that forward. Any tips for family-run organizations for how to build that sustainability in when you get the pilot funding? Like, when do you start going to other sources of funding to keep it sustainable, and what does that look like?
I think you should be planning that even from the time that you propose the project to the initial foundation. Those things need to simultaneously be in the works. I don't think that you can just rely on getting to the end and having data and then seeking additional funding. And sometimes it is beneficial to seek multiple sources to fund parts of the same project or design the project so that if this funder could sustain 10 of whatever, then this funder would sustain 10 more of whatever. And so that if you didn't get funded, it doesn't scrap the whole project. It just lessens maybe the impact of the project and how many people you can impact. But you can design it that way. And usually when you have multiple people that are funding the same project, that looks good to a funder who is saying, oh, well, I'm not the only one with skin in the game, right? Like there's going to be other people who are willing to fund this too. So that can be helpful. But then beyond that funding source, I think you need to be thinking about what that would look like even as you're designing the initial project. That needs to be ongoing the whole time.
I would only add that, view a foundation partner as similar to someone you're purchasing a car from. Okay. I wouldn't say a car salesman because that would give you a bad connotation. But honestly, my point is you can negotiate. And so if you're being asked to do a pilot project, that's often because we're not sure about you, we're not sure about this, we want to see how it goes. And if it goes well, we'll invest. And that's the mindset of a pilot project. So ask from the beginning, what does it look like if this goes exactly as you hope? And if the answer is more funding, then you've got an opportunity. Get the work done, do it right, do it well. And if the answer is then you'll need to find another funder, maybe reconsider, because what you want is an opportunity from that foundation to believe in your success and to let you keep going and then create a pathway. But I read negotiation books all the time. This goes back to my comment about business strategy, not because I want to have harsh negotiation. I want to have meaningful conversations with people about what they want and how I can align with the goal they have. And if I can align, I either remove myself from the idea or I ask if they're willing to move to the way in which I can align. So don't rule it out, but also decide if they seem committed to you or not if you succeed.
Great advice. Such wonderful tidbits here throughout. Oh, we got taken off of our slides here. Thank you all so much. We are so lucky to have Carla and Ricky come back in June. Carla started out giving us some grant writing tips, and Ricky added a little more knowledge to that, but we're going to dive deeper into how to write grants that actually give you that funding. And then we are also going to talk about the family peer career ladder. What does it look like? Where can family peers go in their career? And we're really excited. You can register in the same link, and I think Gina and Lachelle are going to put that in the chat. You've got all of our contact information. Reach out if you have specific questions. A reminder that we will be sending you the slides and a recording link if you registered for this event, so look out for that. And now comes the part where we beg you to take our survey. As we mentioned at the top of the hour, we are funded by SAMHSA, and SAMHSA determines its funding by how much people benefit from our programming. So please pull out your phone to scan that QR code, click the link that Gina and Lachelle are sharing in the chat, or if you just close out this Zoom meeting, it should pop right up on your screen. It's a very simple, short little survey, and it really does help us deliver the trainings that our audience wants and needs. And it also helps show SAMHSA that programming for the family peer support workforce is very crucial and much needed. We thank you so much for being here today, and we hope to see you next month at the next training.